Hello everyone, my name's Melissa, and I will be going over the basics of sleep that have been covered in Sleep and Dreams. So first, what is sleep? Sleep is a natural restorative physiological process that's characterized by perceptual disengagement and must be rapidly reversible. So during sleep, we are most vulnerable, but also during sleep, we garner up energy so that we can take on the day once we are awake. We maintain our metabolism and also aid the process of removing metabolic waste from our body. Sleep is defined by our circadian sleep rhythms, and within our circadian sleep rhythms, there are 4 stages. First stage being non-REM sleep, in which you are awake, but in which you think you're awake, but in reality you're asleep. So this is drowsiness. The second stage being non-REM light sleep. And in this stage, our body temperature lowers and our heart rate becomes a bit steadier. Stage 3 is also non-REM, and it is characterized by deep sleep and delta waves. And stage 4 of our sleep is REM, or rapid eye movement sleep, and this is a stage in which we are capable of dreaming. In this course, we have emphasized that drowsiness is red alert, and this has to do with the fact that the most common cause of death for people our age range that are in car accidents has to be due to drowsiness. So the danger of not getting adequate sleep can be fatal. And there's a need to kind of emphasize how dangerous sleep debt can be, because not only can you potentially be in a car crash because of the drowsiness caused by sleep debt, but also sleep debt can cause symptoms such as trouble falling asleep or staying asleep that could then become syndromes, and those syndromes are most commonly known as sleep disorders. So the importance is that the more sleep you get, the less sleep that you'll need, and the less sleep that you get, the more sleep that you'll need. And so maintenance of a sleep balance is incredibly important for people. And speaking of sleep disorders, some of the most common sleep disorders are insomnia, sleep apnea, parasomnias, and narcolepsy. Insomnia is characterized by the inability to go to sleep or stay asleep, and 12 to 15% of people have chronic insomnia. Sleep apnea is characterized by a pause in breathing during sleep that can last 10 seconds or longer. And this is when the brain is prioritizing sleep over breathing, which can be truly fatal. Parasomnias are undesirable events that occur in our entry to sleep, during sleep, or during arousals in our sleep. And a common example of this is sleep paralysis or sleepwalking. Narcolepsy is defined as an overwhelming daytime drowsiness that makes it very difficult to stay awake. And this drowsiness could be very dangerous because you don't have much control over it. A common misconception about sleep is that we sleep throughout the whole night, when in reality we wake up in intervals of around 2 hours when our circadian cycle has finished to start a new one. We just don't tend to remember this in the morning. Also, we tend to have a lot of misconceptions of how alert we are. For example, we might believe that we're fully aware of our alertness, but actually be drowsy, further emphasizing the need to have adequate sleep and the danger that drowsiness can cause.
Hi everyone, my name is Valeria, and today I'll be talking about what sleep hygiene is and how you can achieve a healthy sleep hygiene routine. So, sleep hygiene is most easily explained as being a set of good habits that ensure you get a good night's sleep. Everyone's sleep hygiene can look different. Not everything is exactly the same for each person. In fact, some of the habits that you have right now can be considered sleep hygiene. Now, you might be wondering why sleep hygiene is so important. It's because sleep is important for both the mental and physical health of each individual, and in order to achieve a good night's sleep, you also need sleep hygiene. Establishing sleep hygiene can help you set other good habits in different parts of your life. For example, waking up every day around the same time, winding down from the day, and that allows you to reflect on the day and making more time for other activities. It can also help with other health problems. While sleep hygiene is important for everyone, we specifically want to focus on individuals who are struggling with mental illness and how sleep hygiene is extremely important for them. This is because people who struggle with mental illness can have a harder time getting to sleep. They can often be disturbed with insomnia, nightmares, and sleep paralysis. Although this isn't common in all mental illnesses, it is common in a lot of them. I do want to clarify, although sleep hygiene isn't a solution to any of these problems, it can certainly help alleviate them. Setting a routine of any kind is helpful to individuals with all kinds of mental illness. Having a steady sleep schedule can help them keep track of medication. It can also be helpful in detecting sudden mood swings and changes in energy levels because they know that it's not due to sudden lack of sleep if they are keeping a good sleep hygiene routine. Another reason why sleep hygiene is extremely important for people struggling with mental illness is because a big part of sleep hygiene is allowing time to wind down and get ready to sleep. This time can also be used for reflection and can reduce anxiety. In fact, 2 treatments for mental illness, CBT, cognitive behavioral therapy, and DBT, dialectical behavioral therapy, center sleep hygiene as one of the main things to focus on for treating these problems. This is because these treatments want to establish a base level of stability. So if the basic needs of an individual are met, such as sleep and food, then they can address sudden shifts in mood, energy levels, and other issues that may be due to their mental illness. Now that you have a better understanding of what sleep hygiene is and why it's so important, we have to talk about how to establish it. So, in order to successfully establish a sleep hygiene routine, it is important to start small. Gradually make changes instead of trying to change everything at once. This can look like gradually changing your sleep time by 1 or 2 hours. You should start by establishing a time that you'd like to get to sleep by. Give yourself time to wind down. This includes putting down electronics. This part is super important. You should also try to not eat within a couple of hours of your desired sleep time, as eating right before sleep can make it more difficult. You should also ensure that your sleeping area is in the best condition possible. Don't have bright lights on while you're about to sleep. Make sure that you are mainly using your bed to sleep and not do work on. You should associate your bed with sleep. Make sure that you are comfortable. This can mean lowering the temperature in your room, having soft pillows around, using an oil diffuser, or anything else that makes you feel calm. There are also different methods that you can wind down. You can listen to nature sounds, and you can also use a sleep app without looking at your phone for too long to help you get ready to sleep. Remember that you can't expect to change your sleep habits overnight. It can take several weeks. The most important thing is to make a routine and try to stick to it as closely as possible. If you have any questions for us, please make sure to leave them down in the comments below. We also want to thank you for watching our outreach project.